Part two now of my interview with the Chief Medical Officer of Eisenhower Health. Now that there are three vaccines, is there any reason at all why someone should choose one type of vaccine over another?
No, I really think all of them have shown tremendous effectiveness, and that's the key, and also tremendous safety. We've seen virtually the same gamut of reactions in all three vaccines, primarily mild symptoms, headache, a fever, some body aches, and so on, soreness at the site of injection. So, very, very few serious reactions with any of the vaccines. And when we look at the benefit, it far outweighs the risk associated with getting those vaccines. So, I think the most important thing for people to really focus on is just get the vaccine as soon as you can and don't worry about which one it is. All three are very, very effective.
I'm curious, what have you learned about the variants of the virus in California?
Yeah, we continue to identify even more variants out there, and that's not a surprise. This is exactly what viruses do. They continue to mutate all the time. And by selection, the mutations tend to be more aggressive and sometimes more deadly. They're going to spread faster, and therefore we're going to see more of those. At this point, I think the most important thing, again, is for us to recognize that the vaccine still seems to be effective against the vast majority of those, maybe slightly less effective against some than others, but still very, very important that we just keep our eye on the ball, get people out there to get vaccinated as quickly as we can. That will stop the development of more and more aggressive variants over time if we can get people vaccinated and prevent them from getting seriously ill and spreading the disease.
And before we let you go, any final thoughts on where we stand today with the pandemic here in the Valley?
I think the most important thing for people to just still keep their eye on is the fact that it's important to continue to do the other public health measures with the mask and the distancing and so on. We've identified very recently two patients who were fully vaccinated against this virus more than 30 days ago, and yet have come down now with COVID-19 and symptomatic. Fortunately, not severe symptoms, not requiring hospitalization, but clearly did get sick with COVID-19 despite vaccination. And we know that's going to happen. We know that this is not 100% effective against getting the virus. The vaccine probably prevented them from becoming seriously ill, which is important, but it's also important for us to recognize that it's still possible to get sick with this virus and still be a carrier to spread it to other people. And that's really the message I want to get out there, is not for people to worry that the vaccine wasn't effective. It was to understand that that's not a complete guarantee that you couldn't spread the virus to others.
I really think that's an important point to make, Dr. Williamson, because I think a lot of people think that the vaccine is sort of a silver bullet, if you will, to protect them against the virus. But like you're saying, the reality is you can still get sick with coronavirus even after getting both shots.
Yeah, that's correct. And, again, it's still critical that you get that shot because we're reducing the risk that you're going to become seriously ill by at least 95%, perhaps 100%. But the possibility still exists that you can get the virus, perhaps be even asymptomatic and spread it to others. So until we really get everyone into the same boat where all of us have been fully vaccinated, it's still critical that we pay attention to the fact that we can be carriers of this as well and spread it in our community. So we have to take that into account and continue to use all the same measures. Even for those of us who have been vaccinated, we still continue to wear the mask, still continue to practice exactly the same public health measures that we've been dictating all along.
Good information. All right, Dr. Williamson, we appreciate your time. Thanks again for joining us.
You're welcome, Peter. Thank you.